Hello everyone, my name is Mahi, and in this video I will be presenting to you all a section of Chapter 2 from the book mHealth Fundamentals and Applications. We all know that mobile communications have been developing its technological aspects every day, but according to this book, we are still behind on medical sensing, and I think it's because these technologies have not met patient and provider demands. And by demands, I mean that these sensors that have been created are not as compatible with the evolving technologies in today's healthcare. So smart sensors basically need to be changed and modified in a way that would be acceptable by doctors and patients for everyday health monitoring. Some smart sensors include wearable technologies, wireless sensors, and etc. that I will get into as I go. There might exist a lack of classification and taxonomy because of its complex process. The main reason for that is the misunderstanding of the concept of mHealth. We have been defining it mostly as a wireless monitoring and health status concept using mobile technology, including smartphones. This definition is true, but only to some extent. There are many definitions to mHealth that have been researched and are still in the process of being researched. Till date, there is no such as a perfect definition of mHealth. In order to keep wireless health monitoring sensors organized, an early taxonomy was created and it consisted of four categories: SGSP, SGMP, MGSP, or MGMP. And this is based on static or mobile gateway and stationary or moving patient. Since the earlier taxonomy only covered wireless health monitoring, a new taxonomy was later created that reflects the basics of mHealth, and it is based on an understanding of the fundamental difference between health, illness, wellness, and well-being and their relevance to the mHealth continuum and applications. They range from non-invasive through minimally invasive to invasive. The new taxonomy consists of health and wellness monitoring sensors, diagnostic sensors, prognostic and treatment sensors, and assistive sensors. In the picture, you can see that these categories have their own subcategories. mHealth system includes public health, primary care, emergency care, and chronic disease and wellness management applications, which are all covered under this taxonomy. Since mHealth is rapidly evolving, there will be modifications to these categories and subcategories in the near future. The technological developments of wireless sensing is growing. According to Tarasenko, wireless monitoring sensors are the front end of health and wellness monitoring system because these are the sources of a patient's medical signals that need to be measured and monitored. It is much easier to transmit signals via low power technologies such as low energy Bluetooth or Zigbee to a smartphone. This allows doctors to log in any medical data and information to the system, which is accessible to the patient anytime from any location in order to manage their care. Although it is yet to be verified, this system could potentially be cost effective in developing countries, especially where the lifespan is longer and health problems cost more when people age and consume alcohol and drugs. There are many wearable and nanosensors, but some of them include heart rate monitors comprising electrodes in a chest band with a short-range wireless link to a wrist-worn display, and others are cuffless blood pressure meters, thermometers, glucose meters, peak expiratory flow meters, activity and wellness monitors, pulse oximetry sensors, and inertial sensors. There are technical and environmental specifications of sensors. Sensors are used by people, and in order to function properly, it has to be people friendly. Most people use sensors to track their exercise, which includes a lot of mobility, so sensors have to be acceptable of mobility of a person. With exercise comes sweat, so sweat proof is a must. Sensors must be exposable to extremes of temperature, including humidity and shocks. They must be worn without causing discomfort to the consumer, so it must be light and small. Last but not least, it must be able to operate wirelessly for longer periods without having to worry. Long-term monitoring using sensors can be beneficial in many ways. It is important for treating chronic diseases and vital signs such as heart rate, electrocardiogram, and blood pressure. Monitoring allows doctors to make a diagnosis leading to improved health or make patients aware of possible life-threatening conditions. Monitoring lets providers observe a patient during recovery period, for example, post-surgery with rehabilitative care. It also lets a person detect irregularities in own health to start care sooner than later. Long-term monitoring also lets doctors observe patients' adherence to drug therapy to see if any modifications is needed for better care. Long-term monitors can be used for personal use as well, and there are many types of smart wearable wristbands and watches in the market, such as Apple's Watch, Fitbit, Jawbone Up, and Spree Smart Cup. The main reason to monitor is to improve one's quality of life. We do live longer now because of healthier eating habits and lifestyle, but with longer life comes diseases. Also, because of chronic illnesses and increased health problems by age in the elderly patients, they are the ones to be monitored most importantly. Activities of an athlete are monitored while they swim, run, cycle, and train in various other sports. A lot of people want to take care of their health and well-being nowadays, so people self-monitor as well by buying less costly to expensive monitoring systems that are not always clinically reliable and can only sense in limitation. There are a lot of things that could be monitored, but there are some things that are monitored more than others, such as ECG and heart rate. ECG sensors monitor electrical activity of the heart. Wearable wrist heart rate monitoring and tracking sensors monitor frequency of the cardiac cycle and recording of the heart sounds. Another one is SICD, which stands for Subcutaneous Implantable Cardiac Defibrillator, which is inserted under the skin beneath the armpit and it detects irregular arrhythmia. The picture on the left shows how SICD is inserted. Blood pressure can be monitored with a wireless cuff-based device. It is lightweight and much smaller than a blood pressure inflatable pressure cuff. This device is linked via Bluetooth and it monitors hypertension, prehypertension, or hypertension. Blood glucose levels can also be monitored using a CGM, which stands for Continuous Glucose Monitor. It is a microsensor injection that is inserted under the abdomen as shown in the picture on the left. This lets users avoid the continuous painful finger pricks. And this concludes my presentation. Thank you.